Hello, this is Selin. Actually, in hospitals where there's not much psychiatric consultation, it is quite an important topic, in particular after the earthquake. The causes of amputation in children and how we can inform the child about the amputation decision. Amputation, as you all know, is the surgical removal of a part or the total of a limb. Amputated child, despite unclosed epiphysis, is defined as someone who has some skeletal development insufficiency or amputated for any reason. The main causes of amputation, I would say, is not my talk, but still very briefly I will mention. It's mostly congenital abnormalities, trauma, traffic accidents, burns, or like being under the ruins of an earthquake, infections, cancer, and very rarely vascular pathology can lead to amputation in children. And according to the studies, mostly 60% of childhood amputations are due to congenital reasons, 40% due to acquired. For as different from our country, the main cause of traumatic amputation, especially in Europe, it is mostly the tongue machine, electrical tools, or some cutting tools. Different from the developed countries, in Turkey it is mostly car accidents, industrial again injuries, electricity burns, and acquired amputation. And in majority of the traumatic causes leading to amputation in children can be prevented. Why they are not treated? Is it, for example, negligence? What is the reason for this? Of course, it is the topic of a totally separate panel. As for childhood amputation, or if the birth is with extremity abnormality, it is very difficult for both the child and the parents to accept. Amputation can lead to a permanent disability that results in physical and functional losses, and therefore early phase approach is very important because we can actually somehow alleviate the impact on the child. Once amputation decision is taken for any reason whatsoever, it is possible to consult to a child or adolescent psychiatrist, as you all know. Mostly if during the hospital stay, someone who actually is a physician, they ask you to inform about the decision rather than the parents. In daily practice, it is not something we want because someone that the child knows or a physician already taking care of the child is much better to inform of the amputation decision. But once we are asked for help, or at least maybe we can ask to inform the physician or give some advice about how they will inform the amputation. First, it's about informing the family for the decision. Once there is the amputation decision taken, of course, in car accidents or during earthquakes, of course, there may not be the time for this, but in elective amputation, it could be cancer related, for example. Once it is possible to know beforehand, of course, we always have to spare time for this. First, you have to inform the family, of course, in a silent environment, in a separate area. If this is the best decision for the child, then you should inform the family. Because the parents should not cry out loud in front of the child. After we warm up the family, then you can continue with the child. The language to be used is so important. You should not use medical terms, and it is not like cut, take out, not these words. They have to avoid it, and not medical terms as well. And even, for example, amputation at the same time can endanger the life of the child. For example, we've had a loss assessment of your child, Ege, and we found out that that is the best option without actually giving any harm. Of course, amputation is irreversible. However, for the child to use her limbs, there are so many options like prosthesis. It is not something totally irreversible. I mean, at least it can be compensated for. And we have to avoid some rhetorics incriminating the parents. You brought the child late to the hospital. You didn't pay attention. You have to be more careful. And incriminating behavior is not good. And you have to give the opportunity to the parents about how they feel themselves. First, they have to cool down, then inform the child. And informing the child, of course, the age is important, age of the child. Why? Small children are not aware of the situation, cannot know about their future life. But during adolescence, as you all know, physical appearance is so important, such an age group. In this case, they can actually show much more reaction. And by the physician that the child knows, must be informed by him or her. Careful selection of the words so important. There is no standard sentences in informing the child about amputation. Why? Because each and every child can have different questions, concerns. You have to listen to the child if they wonder about anything. Very briefly, without getting into too many details or without using some improper words, you have to clear the mind of the child. And again, you have to highlight to the child that it's a good decision for their health. A couple of metaphors. It's very difficult to actually make a research on this, but maybe you can use actually some matchmen just by drawing or showing. First, this is, for example, once this is the match stick, what would happen, for example, if I light it down, it will cover your entire body. Or if I do not actually take out this rotten side of the fruit, what would happen? Possible to make actually some metaphors. In case of earthquake or car accidents, these are immediate actions. Sometimes even you have to do amputation while the child is unconscious. Again, after recovery, you have to inform the child. In this case, of course, you know, we have recently experienced an earthquake and a document prepared also by the Turkish Emergency Response Agency. Again, you first have to know about your emotions. We are not robots, and it's not an easy task to tell the parent or the child about the amputation, informing them about the amputation. Same for us. I mean, making it so dramatic is not good, but of course, it's not something not so dramatic. You have to be serious enough, but you have to have a control of your facial expression and the tone of your voice. And in informing the child, there are some, now I'm going to give you some bad news about your health condition. We actually have to take your finger out of your hand. It will give you more harm. You may not use your hand anymore, but after this treatment, you again will be able to use efficiently your hand after we have some other treatment as well, but we first have to do this. For children under 12 years of age, it's very important to solidify things. For example, showing the hand. There are veins passing by, but as you can see, there's no more flow. If I press my finger in here, you can use, for example, the hose of the line. You see, for example, if I bend it, no more flow. Once there's the flow, the places where there's no flow, it will be a problem. And we will try our best so you will not suffer from pain during the surgery. And then if it is going to be performed with local anesthesia, maybe no pain, but you can feel a pressure. For general anesthesia, I mean, once we use the term you will sleep for a while, some sleep related issues may come up in the future. So Now you will, rather than if you say rather sleep, it's not a normal sleep. We will give you a drug and then you will sleep and then we will give you a drug, then you will wake up. Before or after the surgery, you should never underestimate the fear. Like you're a big boy, you're a big girl, no point in crying, don't be afraid. It is wrong. You have to say, I know you're afraid, it's quite normal. You're very sorry about this, but we will do our best so you will not suffer any pain. And of course, in children, they are so egocentric at that age. Therefore, they may put the guilt on themselves. So uh, it is not your fault. It is not because of you that you're having the surgery. So we have to make sure that the child does not blame his herself. And maybe you can say there are some others who experience the same with you. Maybe introduce them to other amputated children or adults. So, in general, my colleague also will follow this, but after amputation, psychiatric follow-up is so important. Hatice from Aydın provide an example. To an orthopedist, they ask for consultation, an amputation decision, and would you please inform the child about amputation? And then they said, we cannot say it, we will accompany you. And then what kind of a language they might use. And then all together, while informing about the decision, the resistant of the orthopedist said, you see your hand, today we will cut this. That's how. And of course, think about the trauma of the child. And the professors really cried out a lot just to actually experience such an observation. As I told you, no matter what, amputation is traumatic and anxious for all parents and children, even if the actual difficult times start after amputation, but informing properly is good, also for the progress. After the amputation, physical rehabilitation and psychological support is so important. So follow-up after amputation is the most important thing. Thank you.